Hello, this is Paul Margulies from the Center for Practice Innovations, and joining me in the background is Nancy Coble, also from CPI. This is a re-recording of a webinar that occurred on June the 7th, and the reason why we're re-recording this webinar is because due to technical difficulties, the original recording didn't take. So, today's topic is understanding complex needs. Unlike June 7th, we are not working with a live audience. Those of you who will be viewing this as an archived webinar. And so as we get to a variety of polling questions and chat box questions, what you'll see is we're going to pull up the responses that we received from our learners on June the 7th. And I think what you'll find is that there is a lot of really helpful information that folks shared on June the 7th. So without further ado, here's our agenda. We're going to talk about complex needs, and most importantly, how the work of care managers and you, their supervisors, is shaped by consumers' complex needs. We're going to revisit engagement, very quickly review motivational interviewing and cultural activation prompts, which we've covered previously, and then introduce two other tools, listening skills and also the cultural formulation interview, both of which are very helpful around the engagement process. Then we're going to talk about finding the courage to move ahead and accomplish personally meaningful goals, some models to help guide care managers and their supervisors. Once again, a very quick review of the stages of change in SCARF, which have already been covered previously. And then we're going to introduce to you one more tool, and that's the Psychiatric Rehabilitation Readiness Assessment. So quite a bit that we're going to cover, and we're going to take it away now. What are our learning objectives? Understanding the variety of consumers' complex needs, identifying the challenges for care managers in working with individuals with complex needs, increasing familiarity with four strategies or tools related to engagement, increasing familiarity with three models that shed light on the process of change, and implementing supervision to help care managers develop or enhance competency in three areas: working with individuals with complex needs, engagement, and supporting individuals to find the courage to work on personally meaningful goals. Let's put some context and history together so we have a sense of why we're talking about this today. So, traditionally our systems of care have been organized in silos with different needs addressed in different locations by different providers, and typically with little to no coordination. Those of you who have been in the field for a while, this will sound very familiar. One consequence has been that providers assessed and addressed the needs of individuals within a given silo and ignored or at best referred out other needs. So what happened? This resulted in a lack of understanding concerning the complexities of many people's needs. It also resulted in the kind of fragmented, uncoordinated, and non-integrated care that we're trying to fix now with many of the changes in our systems transformation. Integrated care is seen as one solution to this problem. And health homes are key resources in the effort to transform the fragmented systems of care into one that is integrated and addresses the whole person. And you see we bolded whole person because this is where complexity really arises. Because of this, care managers and their supervisors are now more likely to encounter individuals with complex needs and focus their efforts on addressing these needs. So that's our history and context. So one way of looking at complexity is by looking at SAMHSA's 8 dimensions of wellness. Some folks who are viewing this archive webinar may be familiar with this. Some might not be. But SAMHSA has defined 8 areas, 8 dimensions of wellness. I'm not going to read every word on your screen, but what I will do is I will identify what those 8 dimensions are. Emotional, environmental, financial, intellectual, occupational, physical, social, and spiritual. And all of these interact with one another and really contribute to the richness and the complexity of who we all are as people. Another way of looking at this are the kinds of domains that we address, that you will be addressing with recipients of care, that really can contribute to the complexity. So there's mental health, there's substance use, there's primary care, there are basic needs, safety, income, housing, And there are the individual, personally meaningful recovery goals. There's a lot going on. And what's very important is to point out, and we do it at the bottom of the slide, that these needs do not exist independently of one another. Instead, they're interacting and influencing each other all the time. If we were to draw a diagram, you'd see arrows and feedback loops constantly tying all these needs together, hence the complexity. So the first chat box question is, what complex needs are consumers presenting with? Please provide some specific examples. And we will show you the kinds of responses that we received in the webinar previously. And you see them begin to populate on your screen, and I'll read some of them. And I'm going to start to read as others begin to populate. So the question once again, what complex needs are consumers presenting? Lack of housing, strongly influenced by mental health challenges. Comorbid diseases with no linkages. Navigating the healthcare system. Safe and appropriate housing resources are limited. Poor engagement with medical care providers. No insurance or underinsured. Food issues. Not having healthy food available. Transportation issues. Mental illness and dangerous substance abuse, and co-occurring medical conditions such as diabetes and hypertension. And I'd ask you, the folks who are viewing this archive webinar now, whether this rings true from your own practice. Or think about whether you have other, complexities that you're dealing with. Okay, thank you. So we're going to move on. And we had a polling question. And the question was, what percentage of consumers now seen by your care managers present with complex needs? And what you can see is every response that we had indicated at least 50%. So it was about 39%, 50 to 74%, about 45%, the bulk of our respondents were in the 3/4 to 90% range. And for some smaller number, over 90% of the consumers presented with complex needs. So bottom line, these folks are being seen by your care managers lots of the time. And you might want to give some thought as to how this applies to the care managers with whom you're working. Okay, so moving along, another chat box question that we asked was, how do these needs differ from the needs presented to case managers in the past? And you begin to see some responses populating, and I'll start to read them. There have always been complex needs, but we are now seeing much more substance abuse, specifically with opiates. It can be harder to find linkages due to lack of providers that accept Medicaid and Medicare. More people need services, and services are being cut. My program began as an HIV COBRA case management. Since the inception of health homes, they've had far more complex issues with comorbidities and behavioral health diagnoses. And another person writes, language barriers with health insurance and transportation. So it sounds like for many care managers, things have begun to change, and we can anticipate they're going to continue to change. Next question we asked, what do care managers now need to know or do to effectively support individuals presenting with these complex needs? New things they need to know, new areas of knowledge, as well as new skills. And I'll begin to read the responses that we received. More knowledge of resources available and access criteria. So people need to know what's out there and how to get to it. Utilize all local resources, government and other nonprofit agencies. Staff need to be able to network and utilize the skills of their peers. Be very well versed in the housing application process. Effective patient and healthcare provider management, provider engagement. So here's somebody highlighting this whole issue of engagement with consumers as well as with other providers. Understanding how to triage your caseloads. a lot more organization skills, documentation skills, collaboration skills, as HARPs and increased regulations by the state are making the job require a lot more skills, even though the salary hasn't gone up. We understand. But the point being made is a very important one, is that for folks who had been case managers in the past that are now making the transition to care managers, there's a lot more that's asked of them and more competencies that need to be developed. Discharge planning, setting boundaries with patients and caregivers. Also, with caseloads growing, they need to be able to find ways to manage time and juggle their caseloads with many clients who are getting sicker and or aging. More medical knowledge. Well, we always served individuals with chronic medical conditions in addition to mental illness. With the introduction of health homes, we now serve some individuals with just medical conditions. And that has been a challenge as our staff are social workers with little to no medical training. Very important point. Moving closer to a model of care management with a focus of patient self-care and health promotion. So this whole empowerment and wellness self-management aspect, which is very different from how many people had operated, years in the past. There is much more of an emphasis on, doing for rather than doing with and teaching. Specific training in the venue, knowledge resources, collaboration with different agencies specific to mental health. So learning more about the whole mental health realm. Folks need to enroll in more trainings and workshops. I have been finding that engaging and working together with clients who just have medical needs is different than working with typical SMI client. So once again, I'd ask you to think about in your own work and the care managers that are working, under your supervision. Does this ring true, or are there other things that you'd be adding? Next, what do you as a supervisor now need to do to effectively support your care manager's work with individuals presenting with these complex needs? In other words, your care manager's needs are changing, and therefore, what you'll be doing is likely to change as well, and you already may have begun to make some changes in your own practice as a supervisor. And some of the answers we're seeing here: attend lots of HARP webinars, knowledge regarding assessments in areas noted so that people can be linked to appropriate resources, provide more group training, case studies, scholarly articles, and role plays, and these are all the things we've been talking about already since we began this initiative. Spend more time with them and with the difficult cases, and increase contact with clients to assist staff. Support staff and assist with particularly complex clients, so that message we're hearing quite a bit of. Trainings on coaching and employee engagement, so this whole engagement issue. Get to know our staff's caseloads, meeting clients in person so we can get a sense of what the interactions look like. And this kind of begins to move into field mentoring. We need to be able to properly identify what our staff are struggling with and be able to improve their competency in those areas to be able to boost morale. That's great. Okay, we're going to move ahead. And then we asked, so how can we best help you with this? Our job is to help you. And let's see what some people responded. On how to be innovative with trainings or supervision so that staff is more engaged, and hopefully we're helping with that. More information about how to train staff effectively and how to support our staff in the best way possible, and hopefully that's a theme, that's a thread that weaves throughout everything we've been doing. Promoting adoption of best practice models from assessment through practice and through discharge. For other agencies with success in this area to share their strategies, and as you may be aware, we focus on our smaller regional online meetings. That's exactly what we're trying to do, as well as the face-to-face workshops. We think that's a very important aspect of what we do here is really help people to share with one another. And continue to educate and provide good resources to help us with our staff and our clients. Absolutely. Okay, moving on. So we're revisiting engagement now. We're asking, what are care managers doing well that is contributing to successful engagement? So once again, trying to build on positives, build on strengths. Let's see what people told us. Okay, I'm going to begin to read. following up with the care that they are providing, as well as communicating with clients regarding their needs, providing concrete services, being where the client is at. Usually this means being very concrete with clients, respecting clients' limitations and meeting them where they're at. So this is a theme that keeps showing up here, meeting people where they're at, which is really probably the number one element of engagement. Bringing supervisors on intake when needed, especially for clients who have had multiple outreach segments, so involving supervisors, and it's great that you folks are available as supervisors. Being client-centered, making an effort to meet face-to-face on a regular basis, getting to know clients in a more personal way, learning about their interests, etc., adapting to the client's communication styles and preferences, so this is really about being person-centered. Attending appointments, meeting clients after normal business hours, so this is about flexibility. Once again, meeting clients where they're at. Asking questions, not rushing through an interview. Once again, that's kind of a basic and very important aspect of engagement. And folks are constantly in contact with clients, knowing their needs and following up. That's terrific. So hopefully, once again, this resonates. Okay, so now we're going to cover, these tools. And the next question is, it's a polling question. What percentage of your care managers are currently using motivational interviewing competently in their work? So we're trying to get a sense of how well are people doing in supervisors' opinions. And this is something for you to think through as well within, your own agency. And we see a wide distribution here, but I think it'd be fair to say that there is still quite a bit of need for people to develop the competency of motivational interviewing. So hopefully this is finding its way into people's supervision. Okay, next question. We can move along. Another polling question. What percentage of your care managers are currently using the cultural activation prompts competently in their work? And once again, we covered this some time ago. And what we see is really very little. So once again, tremendous opportunity here through supervision and training to help bring people along. Okay, we're going to move ahead. And we're going to introduce another set of tools that may or may not be familiar to you. And this is just to point you in a direction. There's a tremendous amount of this that you can find on the internet, tremendous training resources. Today, the purpose isn't to train you in how to train your staff in listening skills. It's just to make you aware that there are resources. And for listening skills, typically the way this works is that practitioners learn how to reflect content of what a person's just said, and that's pretty simple, really paraphrasing. Second level is reflecting feeling, which is a little bit more complicated. Sometimes the person will make it clear how they're feeling, sometimes a little bit of a guess. Even if the guess is wrong, that's okay, because it gives the person the opportunity to continue the conversation and correct the practitioner's perspective. And finally, in some ways the most difficult is reflecting personal meaning. Being able to really show the person that you have some sense of what this is all about for the individual. So why do we do listening? Why do we provide these listening skills? And many people call this reflective listening. A couple of reasons. One is it really allows the consumer, it really results in the consumer feeling that the practitioner, that the care manager is trying to connect and really trying to understand. Very, very important. It also, results in the care manager understanding more accurately, because this starts really conversations where you can really dig deeper and learn a whole lot more about what the person, is feeling about whatever's being discussed and what the meaning is for them. So very quick overview. We could spend many hours on this. We won't today, but you can Google listening skills or reflective listening and see tons of very helpful information available to you. Just once again, a very, very quick introduction to the cultural formulation interview, which in some ways kind of builds upon the CAPS, the cultural activation prompts that we were talking about. This is found in DSM-5. The purpose is to make it easier for providers, including care managers, to account for the influence of culture in their clinical work to enhance patient-clinician communication and improve outcomes. It's a very valuable tool for everybody, not just people judged to be culturally different. There are 3 components. There's a core 16-item questionnaire, which can be applied in any clinical setting with any patient by any mental health clinician. There's an informant version used to obtain information from caregivers. And then there are 12 supplementary modules that expand on these basic assessments. Once again, the purpose of our webinar today is not to teach you the cultural formulation interview, but really just to call your attention to the fact that it exists. You can find it in the DSM-5. There is and will be quite a bit of training material coming out. We at CPI are currently working on a module with the originators of the CFI. And this training module will be available this year, and it'll really walk learners through every aspect of how to use the CFI. So for now, just to call your attention to the fact that this exists, and it's a very helpful tool around engagement. Okay, we're going to move ahead. Very quick review of the essential components of supervision. We have reviewed this a number of times with you already, and we'll continue to review this, later, throughout the year. So we've really identified 5 components, and they can even work with one another. They're not necessarily distinct and individual. So there are case presentations, and you may recall that we had presented a format that you might want to follow when doing a case presentation. There's skills training, including modeling and coaching, and in the past we've presented some ways of doing skills training. There's group supervision, field mentoring, and use of data, and it's called database supervision. And what we found very early in the year is that case presentations and skills training and group supervision were being used, by many supervisors. Field mentoring and database supervision, not so much. And our hope and our aim is that by the time we finished our year in working with you, that we'll see an increase in the number of supervisors who've been using field mentoring and database supervision as well. We're going to move ahead. Here's a question that we do not have responses from the original webinar, but I'm going to read the question and ask you to give some thought to how you would answer this question. So the question is, what supervisory strategies can you use to help care managers develop or enhance competency with engagement using motivational interviewing, cultural activation prompts, listening skills, and the cultural formulation interview? In other words, we just talked about the various supervisory strategies. How can you apply them to these topic areas? So please give some thought to that. Now we're going to move on to the segment of today's webinar that focuses on finding the courage to move ahead and accomplish personally meaningful goals. Some models to help guide care managers and their supervisors. And so what are we assuming here? We're assuming that it's not so easy for some people to find the courage, and it does take courage to set goals. Perhaps the individual hasn't had experience in being empowered to set goals, in being a person-centered process. Maybe that's new to the individual. Perhaps due to past experiences, it's hard to get one's hopes up around a goal really working out. Perhaps it's hard to articulate, a goal that might be in the person's mind, but it's really hard to kind of talk about it. There could be many reasons. In any event, to the extent that care managers can help individuals identify goals and find the courage to try to accomplish them, obviously it helps to advance, the person's, agenda. So we're going to move ahead and cover very quickly, 3 models. You've already been introduced to the stages of change, started with pre-contemplation and moving to contemplation, preparation, action, maintenance, and relapse, and helping people if relapse happens. The takeaway message around this is it is critically important to match your intervention with the person's stage of change. If your care manager is working with somebody on pre-contemplation around a particular issue, that might not be the time to move heavily around pushing the person. That might be the time to help the person think through and explore why this might be important and what their needs are, et cetera, et cetera. So it's really about matching, the intervention with where the person's at. SCARF, I think I missed a slide there. Here it is. SCARF is another model, and you can think of SCARF as words that work. It's an approach to communication using words that will move people towards the desired outcome and away from feeling threatened. It's a way to choose and use words that are motivational, that are inspiring rather than scary and threatening. And just to move ahead here, here's the SCARF model. And SCARF stands for status, certainty, autonomy, relatedness, and fairness. And once again, the purpose of this webinar is not to review this in length, but to just remind you of this model that we've covered previously. And finally, we're going to introduce another model that you might find very helpful. I know I do. It's the Psychiatric Rehabilitation Readiness Assessment, which was developed by William Anthony and his colleagues at Boston University at their Center for Psychiatric Rehabilitation. This assessment process has been around for, I would say, easily 20 to 25 years. I've used it in my own clinical practice. I know many practitioners who have. And very quickly, here are the 5 domains. And once again, the purpose today isn't to teach you how to do this, but just really to call your attention to it. And there are considerable resources you can find on the internet if you want to learn more. So the 5 domains are need for change. And how does a person feel a need for change? Sometimes external realities forces the change. The world's going to force it. And sometimes it's because the person is just personally dissatisfied and they want to move on and make a change because they're just not happy. And then there's commitment to change, which has 3 elements. The person has to believe that the change is actually possible. And if it were to happen, that it actually would be a good thing, that it would be positive. And also, it's very helpful if it's supported by other people in the person's life. Third area is environmental awareness, which really means you can't make a change if you don't know what the possibilities are, if you don't know what the options are. Fourth domain is self-awareness, which means knowing my own personal preferences and my values and my interests, because I can't choose an option unless I have a sense of what's important to me. And finally, for those folks who are working with practitioners, or in our case, care managers, personal closeness, what that means is the kinds of interactions with practitioners and the things that the care manager can do to help inspire and help the person to move along. So once again, this is meant as a very quick overview. Not that anybody's going to be able to do one of these readiness assessments as a result of these past 2 or 3 minutes of discussion, but to really point you in this direction. Okay. Here's another chat box question for which we do not have responses, but I'm going to read it and ask you to give some thought to how this applies to your care managers. What supervisory strategies can you use to help care managers develop or enhance competency in helping consumers to find the courage to move ahead and accomplish personally meaningful goals? Once again, 5 or so minutes ago, we talked about the various supervisory strategies that are available. And you have some of your own in addition to that. How can you use those strategies to help your care managers, to help the consumers with whom they're working to find the courage to set goals and to move ahead? Well, please give some thought to that. So, we're winding down, and I want to call your attention to next steps. First next step is to please begin to implement these strategies and let us know how it goes. Now, these original slides were done a few weeks ago, and since the time of that original webinar, we've actually had these regional online meetings, so there won't be another opportunity there. But we do want to make you aware that throughout the course of the year, as we have additional regional online meetings, we're always going to be looking for folks who are willing to present their work. And so, we'll be asking you throughout the year, are you willing to talk about what you're doing related to whatever the topic is? And we're finding, and the feedback we have is people really benefit from hearing from one another. So please be generous about that and help us by being willing to present. Here's contact information that hopefully you'll find helpful. You can Ruth Colon-Wagner, who is the AFRIS lead, Nancy and myself from CPI, and Doug Hurlburt. Doug was the person who on the original webinar presented about SCARF and some other topics. And we want to thank you for staying with us throughout this archived webinar, and we do hope that it's been helpful for you. Thanks so much, everybody. Bye now.